Good afternoon. Today I'm going to be doing a nursing journey video. It's been requested by a couple of people on my Instagram. It was already on my list of things to film, but it was requested, so we're going to film it. It's short because I'm only 21, so I really have only been nursing for like 5 or so years. I started 5 years ago, but it's still a journey nonetheless. And if it helps other people, then it helps other people. That would be really, really cool if it would help some other people. So let's get into it because it's only short and it's going to be like the shortest video. And sometimes I talk super quick, so it may be super short and it might not even make my YouTube, but stop talking, Millie. Okay, so I started in 2017 while I was still at school in year 11. I started my AIN, so my assistant in nursing. I started that through TAFE and I did it all through year 11 and through year 12. I had my first placement. I was 16. I hadn't even turned 16 yet when I started my course, but I just turned 16 by the time I had my first placement. So being a little 16-year-old, I had never, ever seen another person's body. Traumatized. I went on one placement and I actually went there for like 1, maybe 2 days. Actually, I only been there for 1 day, and I went back on my second day and I had a massive panic attack. I walked in there and I went home after my first day and I actually said to Mum and Dad, I am not going back there. I refuse to go back there. I hate it. I never go. I never want to be a nurse. I don't want to do that. That was terrible. So my first day of placement was actually the most traumatizing day to this day of my nursing career. When I went on this placement, I was 16. I was a full child and I had never, ever done anything in regards to other people before in my life. Like, I worked as a pharmacy assistant in a pharmacy. So like having to take care of people wasn't my thing. I had never really had to take care of kids or anything like that. I never had like a babysitting job or anything like that. So I had no clue what I was doing. Not that like adults and kids are the same, but they're similar. Like, they're a similar aspect. So like, you know, I had none of that. No background whatsoever. And I went into this nursing placement and I was left in a room with a patient just to sit there and watch her eat to make sure she didn't choke. And I was traumatized. The thought, they literally said to me, just make sure she doesn't choke. The thought of this patient choking while I was there was so traumatizing to me. And she was just, this patient in particular, she had a bit of a schizophrenic background as well. So she was talking to other people in the room and I didn't understand that, like, you know, when you get dementia and when you have schizophrenia and those sorts of things, I didn't understand that you saw other people, like, and I didn't understand that they would talk to other people. And I was traumatized. I was like, what the heck is going on here? This lady was talking to her mother and I was there for an hour in this room with this lady who was talking to her mum and was like not chewing her food properly and was like swallowing these big things of food. She didn't want to be fed or anything like that. So I was like, she's gonna choke. And what do? I had no clue. They didn't tell me what to do if she did choke because, like, you know, that would be common sense, wouldn't it? And I was legitimately traumatized. Like, I was petrified. The place smelled like death. I smile because it's something that until you have like nursed for a while, you don't know the smell of death, but it felt like death and it smelled like death. And like, I've obviously been nursing for 5 years now, and I've dealt with quite a few deaths, and I've dealt with quite a few dead bodies and those sorts of things. And now, like, I can tell when someone's dying because I can smell it. And like, there's a few cues that, like, once you've dealt with it enough, that you pick up. And like, walking in there, it was cold and it was bad. Like, I was outright traumatized. I went home, I had a panic attack. I told Mum that I wasn't going back, that I hated it. And Mum was like, no, like, you can do it, you're fine. Like, and so it was my dad, like, they were both like, no, you can do it, you're fine, go back. And I was like, no, I'm not going back there. Like, that place makes me suicidal. I'm not going back there. I went back the next day and I was like, you can do this. I walked in and I had a panic attack. I walked in the front doors. That's as far as I made it, was the front doors. Didn't even make it to my ward or anything. I was like, not today. Had this outright panic attack, and I made my dad come back and pick me up because I was traumatized. And like, this is going to sound like I'm like talking people out of it, but honestly, when you're on placement, the people that you work with, the environment that you're in is 150% what makes or breaks your placement, and what makes or breaks the love that you have for that, for that job. I hated it. Never wanted to be a nurse after that. I was like, nope, I'm done. So I called my teacher and I was like, I'm not going back there. I'm done. That's it. I'm quitting. I'm dropping out. I don't want to do it anymore. And I vividly remember my parents and I having this outright argument, and I was like, I am not doing that. And being 16, of course, I knew what was best, and that was it. Like, there was no if, buts, or maybes about it. So I went back to school. While I was meant to be on placement, I went back to school and I spoke to my careers advisor about what I could do to drop out of that course, because it was already like halfway through the year. So like, I couldn't drop the course because it was a 2-year course, and like, that was what was making my like units up. And I was like, no, like, I'm not doing this. Like, that was terrible. Like, Anyway, I couldn't drop out and I couldn't change classes or anything like that. So I just basically had to either put up with it or I had to drop out of school. That was it. Like, there was no other choices that I had. I decided that I would just put up with it for the moment and decided what I wanted to do. They ended up finding me another place to go on placement. And I went on all 3 of my placements there. They were amazing. At this nursing home, amazing. It was a brand new nursing home. The staff, amazing. I could not fault them. They were so amazing that like, I actually, when I finished school, and I'd sat my HSC exams, the day that I sat my last HSC exam, the day before, I had an interview with the nursing home, and I got the job on the spot. They'd already told me that I had the job before I'd even interviewed for it. I just had to go in for a formal interview. And I was like, oh, I can start tomorrow afternoon, because I had my last exam the next day. And they were like, okay, like, just relax a little. Let's like do the day after. And I was like, okay, cool. So I went in and I did orientation, and I did what else did I do? I did a couple of buddy shifts, because there was a few shifts that I like hadn't worked. I'd done all mornings when I was on placement. And so I did all morning shifts. So I did a couple of afternoon shifts as a buddy shift, and then I was put on the floor by myself. And I loved it. Loved it, loved it, loved it. And then management changed and stuff. And I started there in 2018. And I finished there in 2020. So I worked there for no, 2021, sorry, 3 years I worked there for. And I loved it for many years, but management changed, and management really makes or breaks a place. And if you don't get along with your manager, they make your life living hell. And as much as I loved the place and I loved my residents and everything, they were the only thing like keeping me there was like some of the staff and my residents. Once I left, it was like a whole like burden lifted from me. Like I ended up really hating my job and wasn't sure whether I wanted to be a nurse because of working there. Management really, 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 and I cannot stress this enough, management really makes or breaks a place. Makes or breaks a place. So in 2019, I started my enrolled nursing because I didn't get the marks that I needed in my HSC to go to uni to become a registered nurse. And I was so heartbroken and upset. I was like so upset because I didn't get the like marks that I needed. Excuse me. Wow. I'm on my third coffee too. I actually have coffee sitting here. Coffee. Speaking of which. And I started my enrolled nursing with the same teachers that I had at like TAFE while I was at school, and they were amazing. Love them. Absolutely love them. I love those teachers. They have really taught me everything. Like anything and everything that I needed to know, they taught me. I can't stress this enough. They were amazing. WT, shout out to you. So once I started that, I was like, oh, this is so hard. Like, what the heck? But it got easier and easier as time went on. And I am not a person that does well with assessments, not a person that does well with exams. I'm an on-the-floor, on-the-job learner, and I thrive in the workplace. But put me in front of a computer, ask me to do an exam or write an assessment, and I'm like, I don't know. So that was like the hardest part of my like learning, was actually having to do like the assessments and the exams, because I didn't get it, and I never have done well at school, and that was like just really hard. And in 2020, I came out on the 8th of December 2020. I came out with my registration for Enrolled Nursing Division 2, medication endorsed, and I immediately started looking for new jobs because the job that I was in, as I said, was really bad. I was hating going to work. I was in a depressive episode. I didn't want to go to work. The only thing that I was doing was getting up, going to work, and coming straight back home, and I lived in a depressive episode for 7 months. I had to be dragged in and out of the shower. I had to be dragged out of bed to eat. I literally would go to work. I would, like, the only time I would shower was right before I was going to work, and I would come home, get changed out of my uniform, and go straight to bed. Wouldn't shower, wouldn't anything. I was in a full-on depressive episode, and I don't think that's ever talked about enough, and that will be a whole other video that I will talk about my mental health, but not today. And by the time that I had gotten out of that depressive episode, I was still like hating my job. I didn't want to be there. Didn't want a bar of it. And people in that workplace were they didn't want you to succeed, like, ever. So it was hard. And then I got a job. So I started applying for jobs, and I was applying back in Dubbo, and then my mum actually said to me, oh, like, I've got a promotion in Wollongong, so I'm going to move to Wollongong. Would you like to come? And I was like, oh, of course. Why would you even ask that? So I started applying for jobs up here, and then I ended up coming up for an interview, and I was offered that job the next day, and I was so excited. It took months to start there though, mind you. I got the job in March, 2021. No. Yeah. Just before, I think. Might have been February, roughly around there. And then I didn't start till May 2021. So it took months to get like started in the job. The system was really lacking. And I started in that job, my first ever enrolled nurse's job. Had the most amazing educator, so much support. My num is amazing. Like, you know, I really love the health system. And I have been there for over a year now. Crazy. Like a year and 1 month. Like this time last year, I was in hospital. So like this was, like it's been ages since I've worked there. And like, I love it. I love it so much. I've seen so many amazing people, so many like people who want to see you succeed, who help you with everything. Like if you need help, they got you. Like there's so many mums in the facility too. They're so amazing. Like if I am ever upset about something, they've always got some advice for me and I love it. I love my job there and I've been there for a year obviously. And I started going back to do my enrolled nursing and my registered nursing, and I did have a panic attack and pulled out. I meant to go back in June this year. We're in June, sorry, so I meant to go back this month. And I still don't know whether right now is the time for me to become a registered nurse. I don't know. I don't think I want to right now. I get a bit emotional talking about it because I'm like, I do want to be a registered nurse. But right now, I don't think it's what I want. I don't know. I think if I become a registered nurse, I'd go on to do my cosmetics as well. And I would ward nurse part-time and cosmetic inject the other part-time. But I don't know. I have spoken to especially my brow lady and my lash lady. We have made a few plans, but those plans don't come into action unless I'm a registered nurse, unfortunately. But I don't know. I really do want to do it, but it is the way that the assessments are set out are so hard. Like I really struggle. I do struggle with the work, like the theory work of those sorts of things. So that's my nursing journey. Super short, like it's 18 minutes worth of footage for this. So it's super short, and you know, it's only been 5 years and I've definitely got a lot longer to go. But I cannot stress this enough. As much as the health system is struggling, the health system has been the most amazing like job that I've had. I've only ever worked in the health system. I've never done like food or anything like that. I've never worked in any of those sort of places. I've only ever worked in pharmacy and health. So I've never experienced anywhere else, but I do strongly stick by the health system, and I think that they are an amazing place and like people to work for. It does have its faults, as with any other workplace. It does have its downfalls, it has its arguments, it has all those sorts of things. But I do find that a lot of people do just want to see you succeed. And I've had a few people actually say to me, you should go back and become a doctor. But that's too long at uni. And I suck at uni, so we won't be doing that. We will just be becoming a registered nurse. But, you know, and now I cannulate and I take blood. So, you know, like there is a lot of things that you can do as an EEN, and you can endorse your skills everywhere. But I do really love my job, and I'm so grateful and lucky that I get to work in a job like that. And I just love when, like, you know, people come and ask you questions. They really can learn from you. It's really nice. So that's my nursing journey, and I really hope that it does help people that are looking to do nursing. It is the most rewarding job, but is also the hardest job that I think possibly you could work in, because, you know, you go to work and you can be one day be best friends with a patient and the next day be their worst enemy. And like, you know, I go to work and some days I get punched and kicked and spat on, and then the next day, this person's, especially with dementia, the next day I could be their new girlfriend and the love of their life. Like, you know, it's really hard, but it is amazing, an amazing job to work in. So I hope this helps, and I hope that I haven't deterred too many people from the health system, because we are struggling and we do need more nurses. But I also do know that, like, you know, people don't want to go to work every day and be punched and kicked and spat on, and don't want to have to clean up poop and wee and vomit and all that sort of stuff. But it is a really, really, really rewarding job. And I think my favourite part of job, this sounds so sick and terrible of me to say, but you will never get it unless you've experienced a family member go through this, or you'll never get it unless you're a nurse. But the palliative, like, so the dying part of the job is the best part, because you really do connect with your patients on another level, and you are able to make sure that they are comfortable and that the family is comfortable. And, you know, I personally, even once the person has passed, I talk to them while I'm giving them a wash and getting them ready. I talk to them and, you know, I make sure that I moisturize them and give them the whole care, because I am a big believer that they stand in the corner of the room and they watch you until they have left. But I'm also a big believer, massive believer, that ghosts are real. And I didn't believe this until I started working in a nursing home, and like in health, I didn't believe it. I was like, ghosts real? No, you're wrong. You're done. You're done. You're wrong. But they're there. They're there. Especially when you pop another like dying patient in the same room, they talk. Like, they'll literally lay there and they'll be talking to someone, and you're like, who are they talking to? And sometimes I've actually had patients who have said, like, patients before them have said their name in the middle of a conversation, and I'm like, oh, you there? Like, they sit in the corner of the room and they watch. Big believer. That sounds so creepy, but you'll never get it. You'll never get it unless you work in the profession. Also, if any doctors are watching this, listen to the nurses, because we take care of them 24/7. So if we say they're in pain, they're in pain. Give them more pain relief. That sounds so aggressive, but unfortunately, doctors come in for 5 minutes and are like, they're not in pain. And I'm like, ah. Anyway, thank you so much. I love you all. Goodbye.